A copay is a set amount of money that you need to pay when you have a specific service at either a physician's office or the emergency department. It can range anywhere from $10 per service up to $75 or $100 per service when you come to the ER. And this is an amount that's set by your insurance plan, so make sure that you're looking through the details of your benefit plan to know what your copay is before you come to the hospital or to a physician's office. A deductible in healthcare is very similar to deductibles that you might have on your home insurance or your auto insurance, in that if you have a claim, you first have to pay that deductible, sometimes $500, sometimes more, before your insurance will start making payments. So in healthcare, those deductibles can range dramatically. It all depends on the insurance plan that you have. If, for example, you have a high deductible plan, you may have to pay $5,000 or $10,000 out of your own bank account before insurance benefits start applying. So make sure and plan accordingly if you have one of those higher deductible plans. It can be sticker shock. Every time you have a healthcare service, you will receive in the mail from your insurance company a form called an EOB, otherwise referred to as Explanation of Benefits. That form will show the services that were provided, what was paid for those services, how much you owe for those services, a deductible or a coinsurance, and finally what was sent to the hospital or the provider for the services that were provided. Now make sure and take a lot of attention in reviewing that form, because there's additional information besides the deductible amount and the ongoing annual calculation of how much you've met towards your deductible. There's other codes on the Explanation of Benefits that might determine additional information your insurance company needs in order to cover the service, or a code that might identify the service as non-covered. So make sure and keep those forms and respond to them and file them away, because they are your invoice from the insurance company of what was paid on your behalf. This part can be kind of confusing, and I completely understand. When you come to our health system for services, there's many people on your care team, some that you don't even have a chance to see, those behind the scenes that are working to get you better. Physicians such as anesthesiologists, pulmonologists, pathologists, people looking at your blood, and your radiologists, all of them providing service. Now, some of those physicians and providers are employed by CHI Health, and they're part of our CHI Health clinic. Others are independent. Those who are employed will be a part of your one bill that you get from CHI Health. The others that are independent, specialists and others who cared for you, will send you a separate bill. And I know this can be confusing, so please feel free to reach out for help, and we'll assist you in understanding the multitude of bills that you've received for your services.